Don't forget, guys, to also subscribe to our YouTube channel, The Logic Box with Jones, and then follow us across social media platforms. So let's talk about mental health and preventing it from getting to self-harming or even suicide. A few days ago, we heard the sad news of the former Love Island presenter, Caroline Flack, whom I was shocked. When I heard the news, I was totally shocked and devastated at the same time. And I hate it when it has to be a tragic news that will prompt us to have this discussion. We should be having these type of discussions on a regular basis. So let's talk about mental health. At what point does one realize that they have all this suffering from mental health? I'll come to you first.
Me?
Yes.
I think it's different for every individual. Some people it's over time, and some people it's a quick, I just want to kill myself, and then they do it. Whereas some people have the idea of doing it, and then that's when they know to go and seek help because they feel that they want to take their life, but they're not ready to take their life. So then that's the difference. So I think it works according to each individual, how much, what limit they've got to in their life for them to reach a certain point and say that, okay, nope, enough is enough. I can't do this no more. I'm going to take my life.
But then it's a fine line, isn't it, Adra, where people will say that you just need to toughen up. You just need to hold on. You just need to be stronger. What do you call them? This 2000 millennials. They know nothing about hard work, hard graft. They've got things on the plate. Yeah. It's a fine line, isn't it?
It is, but I think that's the issue. I think we are in a situation now where I think people are brushing things under the carpet and people are not seeking help because they think that they should just be getting on with things. But like you said, it's so different from individual to individual, and mental health issues don't look the same for everybody, and there's not a look to it. You know, I see 1 in 3 of my patients I see every day has a mental health problem. So That's a vast amount of people. But if you all sat in the waiting room, you're not going to know that that's why they're there to come and see me. So I think we have to kind of go away from that kind of thought of get on with it and get over it, because we can see people don't. And I think particularly within the Black community, it's stigmatized, highly stigmatized. You don't talk about having mental health problems because you sometimes have seen how hard your parents have worked or how they got on with things. But sometimes if you even break down, you realize actually, you know, they probably were suffering with depression or stress or anxiety, but it's manifested in other ways. So I think as advocates, we should really be encouraging people to speak out and seek help.
All right, let's talk about some of the symptoms, which constitutes the mental illness. So I was looking up anxiety, mood disorders, and but then, you know, on the flip side, somebody could say this is just part of life. One day you wake up, you feel happy or jolly up, you want to do things, get things done, feel motivated. The other day you just can't be bothered to get out of your, you know, go out there and do something.
And I think this is it. So everyone has normal fluctuations in their mood. That's also normal. But I think when it starts to affect your sort of daily activities of life, if it starts to affect you wanting to go out and socialise with friends, to see family, or things that you actually always enjoyed, that's an issue. If it means that you don't even want to leave the house to go and get local groceries, or you really don't even want to go and take your kids to school, or you really can't, you're thinking of a reason to call in sick, not to see your manager, that's an issue. That's not how it should be. But normal fluctuations, you know, you can wake up and have a rubbish day. That's okay.
So as long as it has an impact on your day-to-day life.
So that's exactly what I was going to say. Like, there's a vast difference. Yes, you have days where it's like, oh, you can't be bothered to do anything. But then you have days where it's like, the thought of even going out to the shop is causing butterflies in your stomach, like palpitations. Like you just don't want to go out because you're scared of what's going to happen, what's out there for you. So that's what I was going to agree with Doctor, just to be like, there's a vast difference between not being bothered to do things and not actually having the effort to be able to get up and do things.
Okay, so you're an advocate. So what drove you?
What drove me to it? Yeah. I would say personal experience, aside personal experience, I think it was more about seeing how people react to mental health illnesses. So the stigma around it pushed me to become an advocate. And I just really wanted to push people to talk more. So that's what made me start Talk to Tiana, because it was all about people emailing me about issues that they wouldn't be able to approach their families or friends about. And we would talk, and literally I would find a way for them to overcome the hurdle that they're currently facing in their life.
If we compare the way that especially ethnic minorities deal with mental health compared to our white counterparts, there's a huge difference.
Yeah, there's a huge difference. And interestingly, we are more likely to be diagnosed with a mental health problem, but we are also the least likely to receive support.
Yeah.
And there's a number of reasons for that. Resources are not great, as we know. Mental health resources are not great, and also, like you said, stigma and cultural hurdles as well that make it very, very difficult. But I also think it's education. There's a lot of stigma also within the professional setting. So I speak quite openly about my own issues and having to seek therapy.
Okay.
And I personally felt more comfortable seeing a therapist that was black, because I felt that she'd be able to identify with me.
The issues that you're bringing to her.
Yeah, so I think that's also another issue for people of colour, because they feel like people won't be able to necessarily relate. But there are lots of really great organisations that kind of will try and tackle that. But also we need to encourage more advocates and people within healthcare within our community to take up those roles as well.
When we talk of mental health, does that mean that somebody has gone mad if somebody suffers from mental health?
We don't like to use that word. We don't want to use that term. But it's the illness itself can cause someone to come across that way. Okay. But there's ways to be treated. So it's when you don't treat yourself, that's when it prolongs, then it gets worse, and then medication takes longer to sit in. But I think the earlier you get your diagnosis, the better. So someone may realize that they have issues, but not go to their GP. So when it's their friends and family that starts to notice, because they've been in denial, it gets to a stage where it's not a point of no return, but it just means that their help will be longer than if they had gone for the early diagnosis. And
I asked this question because we are talking about the stigma, and the moment someone shows signs of mental health illness, then you become an outcast. You start being labeled as this one has gone mad. Oh, especially in Ghana. And, so I just want us to be able to differentiate from, somebody who's having like psychosis episodes and somebody dealing with mental health.
It's funny that you even bring this up, because it's lack of education, literally, and that's what I'm doing in Ghana. My project's around educating communities, the rural communities especially, because they're the ones that are more likely to cast those names of madness or wedia or abodam. Like, for example, my situation, my first mental breakdown, or should I say, my second mental breakdown, I had it at home. And what happened was, I was just talking to myself, and I was walking around the house, and I was just tidying up, and my mum was talking to me, but I was ignoring her. And she actually said to me, "Oh, I don't want to like, that's the community we come from. That's the country we come from." Unfortunately. So yeah, she basically said, had I gone to curse someone, and it's come back to me. And that's when I actually stopped and took a pause and looked at her, because I was just thinking, as my mother, if you see that I'm unwell, you're meant to support me and try and comfort me to see what's going on, not throw negative comments back. So it's lack of education. You know, I remember even the first time I told my mum I was feeling depressed, she said, "A dear in depression. What depression? Why are you depressed?" She didn't understand. But I knew what I was going through at that point where I was feeling at a very low place. So it's literally the education that we need to be telling families that these are the signs and symptoms. If you see your child reserving themselves from you, ask them questions, what's going on? Maybe it's something happening at school. Speak to the teachers. Change of behavior doesn't just happen overnight. It's a gradual process. So I think if families understand mental health signs, symptoms, the different types that are there, there'll be less cases for GPs.
And how did you overcome your mental health?
It's funny enough, it's resilience. I think I've just always been a person that just pushes myself. So, but I did get to a point of like to the extent I was having panic attacks when I was driving, and that's when I decided to seek help. So all along what I'd been doing was I'll be okay. Then when it got to a point where I was having panic attacks when I was driving, that's when I was like, nope, I need to go and seek help. So I went to go and see my GP. They put me on medication, and it's funny enough, even being as an advocate, I was even scared of being put on medication, but the medication actually really helped me. And I'm not on the medication no more, but it helps, you know.
How long? What was the duration?
I wasn't on it for long at all. Think about like a month or two.
Okay.
Yeah, it was. The GP diagnosed me with anxiety, so he put me on medication for anxiety, and yeah. But what happened was within 4 weeks, my doses did go up, because what happened was I wasn't getting any better, so they did put the doses up. But once it got to the 4th, 5th week, I felt okay again.
Was there anything that triggered it?
Yes, I'd come out from a relationship, and yeah, so that's what triggered.
I asked that question because sometimes we forget to look at the catalyst of this whole process. It could be something in your childhood, it could be the pressures from home, you know, and especially within the African community, in the Afro-Caribbean community, because you have parents, especially our mother's generation, where they came over here, and then there's so much pressure to send money back home, to look after family back home. And also they have projects, they build it back home. And not to mention, they don't have the right documentation to work. So then you have somebody, you're working in somebody else's name and money, and a whole lot of pressure.
And that's the thing, because you actually have some friends that don't know how to deal with their friends when they're in that state. Yes. So then that makes it difficult, because then that person has no one to turn to, and they think, oh, my friends should have been there for me. No one's there for me. No one cares about me. If I die anyway, no one will care. So it pushes you to the point of no return. That's when you commit suicide, because you literally think no one cares about you anymore.
Coming on to the suicide aspect, we're talking about how to deal with mental health and preventing self-harming, and also, suicide. Doing a bit of research, and I remember that event I came to.
Yes.
It was mind-blowing.
I still think about that event to this day.
It was mind-blowing, because we had this young man. He was all well put together, and he came to the front to give his speech, and I was hosting the event, and as he was talking, he started shaking. Then his friend came to stand next to him, and then I stood next to him as well. Then all of a sudden, you can see he gained a bit of strength. To see a young man absolutely shattered was heartbreaking. And so I left that event saying to myself, if I happen to be in that man's position, would I be able to go and seek for help? Because the first thing is, you are a man. Men, you just have to deal with this by yourself. You don't even speak to your friends or family. So to you as a doctor, as a GP, with all the lack of resources, and I'm thinking, if somebody from the ethnic minority that's come to you and they talking about their issues, what's wrong with them, how are you able to detect that, hang on a minute, there's more to this than what this person is telling me?
I mean, yeah, it's hard and it takes time and everybody is different. But sometimes you just have to be someone that's there to listen. And I always think to myself, no matter how tired I am or how rubbish a day I'm having, somebody has taken time out of their day to come and see me about something. So there has to be something here. So I think, first of all, men are more likely to commit suicide.
Suicide, yeah.
And they take their lives in very drastic ways, generally speaking, as well. So they're a high risk group, particularly young Black men. They are a high risk group. Yeah. So I think it's always taking somebody's concerns very seriously. And if somebody's coming and telling you that they're depressed, you've got to try and work out. Sometimes there's no trigger as well, sometimes. But you just have to try and encourage them to keep speaking to you, to keep seeing you, and to gain their trust. Yeah. Because really and truly, they probably haven't spoken to anybody. I can think of people that hadn't left the house for like 3 or 4 weeks, and I was the first person that they had seen. So you have to kind of maintain that trust. Okay, I need you to come back and see me in 2 weeks, and I need you to do whatever it is. Okay, I want you to go and buy a paper every day and make sure we'll go to the gym every day or something, because it's so important to that person that actually this person, whether I'm a doctor or not, actually cares enough to say that I want to see you again. So that's my job, and it takes time to kind of gain.
When you were having your I won't say episodes, but when you were going through your mental health issues, your low moment, did you have a friend that you were talking to? Because we keep saying talk about this, but if you don't want to, because I'm sure your first thought was not to go straight to the doctor.
No, it wasn't.
To open up to somebody, right?
So I think I've never had, I can't say I've had someone that I would speak to when I get to that point. But like I said, I've always been a resilient person. So I think that's what saved me, if I'm honest, because I'm not going to deny that, yes, suicidal ideation has happened to me before, but I've had to put myself in a place where I know that something bigger and better is coming for me. So I motivate myself, if anything. Okay. So that's what I would say has helped me. But for those that don't have no one, I think what didn't help was Caroline was told not to post on social media. Yeah. So it's like she became isolated. And I'm not sure how much support system she did have as well. Like, yes, friends and family were around, but you can have friends and family around and still be lonely. For example, when my dad passed and people were coming around, but I felt so lonely just because emotionally I was empty. So I think when you're emotionally empty and you don't have someone filling in that void or someone supporting you to fill that void, that's when you also feel like, yep, okay, I'm going to commit suicide now. But for those that don't have no one to talk to, I would suggest talking to a stranger, because it's easier to
open up.
It's much more easier to speak to someone that you don't know. There's been girls, I've gone out just maybe for a meal with my friends and I've bumped into another random girl and I've known everything about her in the space of 5 minutes, just because she's reached a point where she's so stressed, but she can't talk to her friends. But we've just started speaking and she's been able to open up to me. So I think if people don't have a friend they can turn to or a family member, they should try speaking to a stranger. And there's so much help out there right now. I'm sure Mind are promoting things. Samaritans are promoting things. There's loads of mental health advocates now. You've got social media to help you look for these things and look for help. So I think people just need to try and put an effort into tapping into places where they can seek their help.
You mentioned something that kind of resonated with me, that you're resilient. And I think also what I try and say to people is, I know you feel the worst that you've ever felt, but it's always temporary. If you really feel like this is the worst you feel, it's not going to last forever. It's temporary. So you always have to remember that this is bad, like this is really bad, but it will pass. It might not become amazing. It might take 3 months, 6 months, 2 years, but it's temporary. So just keep pushing with that idea. And it does help.
I think what also people struggle with is how long it's happening for. So for me, I'd say it's taken me about 2 years to finally get my old self back. Like, I can now say that I'm the old Tiana that I was back in like 2015, 2014.
It's a process.
Yeah. It's a really long process. But I think going to talk therapy helped me push the process as well. Going to see my GP, get put on the medication also helped me. And I think also people don't realize that there's things that have happened in the past, but they've decided to push it to the side. So when things are happening, they're like, they may not even understand why it's happening, but sometimes it's triggers from the past that they've not dealt with as well. So I would suggest that people really look deep into things that have happened to them and not ignore those as signs as well.
Adra, so just talk about some of the medication.
Yeah, and I think medication is an area that we probably should talk about more.
Yeah.
Everyone is scared about medication.
Yes.
And, people are worried that they're going to be the zombie that's walking around and they're not going to be themselves.
Yeah.
And it's not true, actually. I've got a lot of very high functioning patients that have been on medication for a very long time, and they're doing really well. But I think it's just being educated, and as a GP, you're there to give your patient the option. So you need to tell them, okay, this is this medication, it does this, these are the side effects, it will last roughly 2 or 3 weeks, and then it should settle. This is good for this. It might not help you sleep, but that's my job.
And I think as a patient, you should ask questions, because I asked questions before I let my GP give me the prescription.
I think the general perception is that you're going to be addicted to these drugs.
Right.
You're never going to be yourself.
Function again without it.
It's not actually that. From what I see, it's generally that people that you start these medications on are generally people that are either anxious or depressed, and they have like an underlying anxiety about what's going to happen if I stop. So it's more that takes over them, that is the reason why they're reluctant to come off medication. But you don't need to come off medication. Sometimes I've got patients that are on really low doses every day and they're doing well. I've got patients that have come off medications and are doing well. So I think medication has like a negative connotation, but sometimes it's necessary. And that combination of medication and therapy generally is a very good one that works well.
And finally, the issue of being sectioned. The moment somebody feels as though they might have an issue, they think, if I go to see the doctors, I'll be handcuffed or tied up and take it to, I don't know, somewhere where, like a psychiatric ward, or I don't know. I mean, the myth is so much out there.
No, but I worked in mental health for a little bit as well, and majority of the cases was drug psychosis. Okay. So people that had taken drugs, like substances, illegal substances, and that had been their trigger, and it got to a point where the family couldn't cope no more. So then you need mental health nurses, you need professionals to be around you 24/7.
Okay.
So it's like going into hospital for a surgery and being in hospital after the surgery for a little bit. Being sectioned is for your own good. Okay. It is actually for your own good. It's to help you recover.
Yeah. So, and I think you'll probably say, I think people have this image of
the straight white jacket.
If you go, and I've also worked, you can't tell the difference between staff and patients. Everyone's in their own clothes, very chilled. Most patients that are there voluntarily, so they're not actually under a section. Okay. So you only are sectioned if you are deemed, if you're deemed high risk. And most patients are there voluntarily because they want to get better. So they can sometimes leave, come back. But the idea is that you're there for treatment, and it's not that at all.
I guess we are the generation that will start this movement and keep it going. Final words from the both of you. I know you've been to Ghana to do, you've had workshops in Ghana as well. It was all over on TV. So how was that experience in Ghana, and how did people take it?
Do you know what? Surprisingly enough, they took to it very well. Everyone, when I first told people I was going to Ghana to do this, everyone was like, I'm wasting my time, because Ghanaians in Ghana, the stigma is too high. I'm not going to get them. But they had questions. And their main concern was around the use of tramadol, because obviously the children over there young people over there are abusing the use of tramadol. Obviously it's used for pain, but they're using it to get high, which is also causing psychosis. But they took to the idea really well. They had questions.
Is the movement as powerful as it is here?
I wouldn't say so, because I would say that I would say in the past year or so that people have been going over to Ghana to do mental health awareness.
Okay.
But I wouldn't say it's as powerful over here. So it can be though, because it's up and coming. People are taking to it.
Yeah.
But obviously I'm doing my work in the rural areas. Everyone else is in the city.
Okay.
So yeah, maybe the ones in the city will take to it, but we'll see what happens.
Final word from you?
I mean, I think that's incredible, by the way. I had no idea, but that's incredible. And I think that's what we need. We need to keep talking about it. We need to kind of remove some of the stigma. So you're sharing your story. I've shared a little bit. People need to continue, because people are going to think, oh, really? You know, and that's, someone's going to watch this and see you and think, oh my goodness, there's somebody that looks like me that is saying,
has gone through it.
Yeah, and it's so important. So I think just keep sharing the stories. And also, if you feel that, you know, like any of the symptoms that we've discussed, to seek help from your GP. If you can't turn to anybody else, and some of the helplines that we've also mentioned as well.
Of course, you can contact the Samaritans 116123, okay, to seek help. We're done. We say a big thank you to Adra Danso and also Tiana for coming on the show today. Thank you very much for tuning in. Don't forget to go onto our YouTube page and subscribe to our YouTube channel. To our Facebook watchers and listeners, thank you for tuning in.